Next, I would like to invite a good friend and a colleague and a sponsor of today's event, David Callecod, who has 2 decades of experience as a leader in healthcare administration. He is the president of Lafayette General Health System, which under his leadership has experienced rapid improvement. So for those of us that remember 15 years ago, 10 years ago, how the system looked and how the hospital looked and how it has transformed not only physically in our community and beyond, but how it has improved patient satisfaction and quality outcomes while expanding the physical plant itself and the regional network and all the awards that it continues to win nationally on a regular weekly basis. But the impact of the hospital system is felt way beyond the walls of the hospital and the healthcare delivery infrastructure in terms of how the system continues to impact the community and all that it touches. So I want to thank David for his leadership and members of Lafayette General System that are here today and that collaborate with us on any number of issues on a daily basis to help improve innovation outcomes and health outcomes in the state and beyond. So with that, thank you. David Callecod.
Thank you, Ramesh. Quicker, please. Good morning, everybody. Good morning. So Ramesh, I appreciate that introduction. And earlier, Ramesh called me doctor, but he's like 3 years premature because I'm just starting my PhD program. But I like the sound of it. It felt good. Yeah, in organizational leadership though, so I'm not going to be treating anyone, just so everyone's clear on that. So it is a pleasure to be here, and it's a pleasure to be a longtime sponsor of this event from the very beginning. And it's very important, certainly, as we bring in thought leaders from not only around the state but around the country to address issues that are here, but also that affect our entire country. And it's wonderful for us to have the ability to participate. Lafayette General is the health system, community-owned, not-for-profit health system that serves all of Acadiana, which is about 9 parishes in southwest Louisiana. We really take care of, as a level 2 trauma center, everything from the Atchafalaya Basin over to the Texas border and kind of midway up to Shreveport. And in that role, our 4,400 employees, 7 hospitals that we own, 2 that we help manage, and 5 others that we're clinically affiliated with. We're partnered with probably a couple thousand physicians over that area. We have 80 employed physicians of our own that form our LGMD physician group. And in that, our focus is to restore, maintain, and improve health of this entire region. And one of the focuses certainly that we have going into this year and in our management and as we grow our population health initiatives is this opioid epidemic and our ability to affect that in our region. And so I'm going to talk a little bit today about sort of what's going on nationally. I have the honor of participating as a member of the Regional Policy Board for the American Hospital Association for Region 7, and then also am the chair-elect for the Louisiana Hospital Association. Will serve as chair of that organization next year. So I'm going to talk about American Hospital Association initiatives, Louisiana Hospital Association, but more importantly, what we're doing here locally to address the situation within our health system. So for the folks here that are going to be doing the coding, I think overall my message is that while hospitals and health systems understand that this is a problem, we all know that this issue cannot be dealt with just with providers working independently and trying to change things within their practice. There has to be collaboration, there has to be coordination, not only within that system, but also amongst all physicians and all providers within the ecosystem of healthcare. And it needs to be a very coordinated response to address not only the initial prescription and prescribing of the drug, but also certainly as that drug enters a phase of abuse. I hope out of this that we come up with different ways to partner, share information, not only between healthcare providers, but also state and local health departments, also certainly law enforcement, which unfortunately has become the de facto healthcare provider for many of these folks as they end up incarcerated. and then also certainly within schools and community organizations. So in regard to the American Hospital Association, what's going on with the AHA, they have 9 priorities to deal with the opioid epidemic, and it is one of the top items in the American Hospital Association agenda this year. And so I'm going to focus in on the Lafayette General green items. So as we look at, one, comprehensive health insurance coverage, making sure that substance abuse is covered. Also, enforce mental health and substance abuse parity laws. And so as we look at that, making sure that there is parity. I mean, this is a condition that is no different than any other medical condition. And so it deserves to have parity in coverage for commercial contracts. Repeal of the institutions of mental disease exclusion. And so what that is the federal requirements that do not enable Medicaid to cover substance abuse with Medicaid patients. And certainly we want the ability to have that coverage because, again, a lot of these folks that end up with these issues are not able to keep employment. They don't have health insurance, and they end up in either a situation where they don't have coverage or they're on Medicaid. The CFR 42 CFR Part 2 talks about the patient information. That's very important, particularly in this environment, because right now we're not able to share information really efficiently and effectively amongst healthcare providers and other institutions that provide any type of care because of that CFR. Also improve the efficacy of the prescription drug monitoring programs. They're throughout the country, but in a lot of states they're very clunky. They're difficult to use, and so we need to make sure that we invest in these as a country so that it again does not impede healthcare providers in figuring out the information in regard to the current use of opioids by each of their patients. Going on down to number 7, encourage and fund prescriber education. I think one of the most important things that we can do as a country, and the AHA feels this as well, is that we have got to educate our providers that what they learned, certainly from the drug companies, what we thought was the truth, is not. And that this opioid crisis is a cancer that is ravaging this country. And so provider education is very important, and certainly you'll see how we're doing that within our system here in a second. So Lafayette General Health, the things we're working on, we know a number of things. One, if you're familiar with electronic medical records, it's all about reducing the number of clicks that a physician has to make, and to make it as efficient as possible. And before I go on, I see a bunch of my IT folks here in the crowd, and also Lafayette General folks. Hold up your hands so everyone can see all the various Lafayette General folks that we have here today. Excellent, thank you. So the IT folks know this. We're trying to reduce the number of shortcuts as we have documentation in the ER. And we want to make it a seamless process as the physicians have to go in and look at the database to look at the current use of drugs with their patients. Creating policy and guidance to include pain medication contracts with all of our employed physicians. We're also working with CME for opioid management, not just within Lafayette General, but us in our statewide partnership that we have with Ochsner Health. And so we're looking at CME throughout that entire organization. And then analysis of opioid prescriptions generated. We currently have the ability to do that in-house for our employed physicians and within our system, and it's been quite interesting and really speaks to my passion that I have in regard to education. So as we look at the PMPM program across the country, you can see the blue states, they're available, and in the green states, they're not only available, but it also is state funded. So as all of us that live in Louisiana know, the state has trouble funding everything. That was a joke. Y'all been following me on the news and the radio about UHC. So our state does not pay for it, but it's available. And so we pay for that integration. Our partner is Cerner, We are a show site for Cerner. We host folks from all over the country, and actually some folks that have come in from Europe, and so we with our partnership with Cerner, we're working to implement this PMPM and the next program, which I'm going to talk about, which is NARCS Care, over the next 60 days. And so within NARCS Care, which is embedded in Cerner, it allows us, in the current workflow of the physician, to do the PMP inquiry. It matches the individual. It provides the physician with an overall, it goes out and searches the databases to look at current prescriptions for that patient, gives the patient a score that predicts their likelihood to become addicted and to have a problem of abuse with the drugs. Also, this program is going to allow us to meet all of the state and federal requirements for monitoring and auditing these processes. And so here's a snapshot of what NARCS Care looks like. And again, you can see the scoring that every patient would have. And so that 36 is on a scale of 99, predicting, using predictive analytics, the likelihood for that patient to develop addiction. And then that final number that you see on here are the current number of open scripts that the patient has. And so gives you an idea of some of the technology that we're using within Lafayette General. Also embedded in the program is education, and so we believe that it has to be readily available to the physician, to the nurse practitioner, to the nurses, to give to the patient at the time of the prescription, so they understand the risks and benefits of the prescription. In order to address this as well from an inpatient standpoint, we're looking at how to reduce diversion or theft of drugs. And so within our system, we use Omnicell, and in this Omnicell platform that we have, which again is integrated with our EMR, we are able to look at the medications ordered, the medications administered, how many milligrams were delivered, how many were actually given to the patient, and then monitor the waste of that drug so that we can very quickly identify if we have an issue with diversion. Addiction amongst healthcare professionals is a tremendous problem, and the access to it is a tremendous problem once someone has this type of addiction. So LHA is the Louisiana Hospital Association. Again, I will begin my term as chairman of LHA in July. Every chairman ends up with a project that they push for the term of their leadership, and so I'm happy to report that the opioid crisis and hospitals really being very active in trying to improve this within our state is going to be my project throughout my term. And so in July, we're going to be rolling out the effectiveness of the programs that we have at Lafayette General and the types of things that we have done to improve this within our community. I hope that I have takeaways from this event that I also can share with the Louisiana Hospital Association, so Louisiana can begin moving this metric and improving the situation within our state. I'll close by just saying I would bet, and I would ask everyone to raise their hands, but I'm not going to do that. I would bet every single person in this room has a loved one, a family member, a friend who has been affected by what I called earlier this cancer. And when it takes hold of an individual, it is absolutely brutal. And this event is important because we need to help give those patients their lives back and those families their loved ones back. And so it's important work that you're doing. We appreciate you being in Lafayette. Certainly welcome to our community. Thank you very much.